Welcome to the Medi queries. Today we will take you deep into the formulation of the pastes, a unique semi-solid dosage form used in the pharmaceutical and the dermatological applications. Okay, so how are the pastes differ from ointments and why are they used where other forms are not? So let's explore their composition, preparation, advantages and more. So stay tuned till the end for the practical examples and the formulation tips. Okay. So first start with the definition of the paste. So what are these pastes first? So paste are the stiff semi-solid external preparations that contains a large proportion of finely powdered substances. Okay, that is solids. So typically pastes have more than 25% of the solid content. Okay, so they are thicker and less greasy than the ointments. Okay, so due to their high solid content they are more absorptive and stay longer on the skin. This makes them ideal for the protective applications such as diaper rash creams and burn dressings. Classification of the pastes. So paste can be classified into three types based on their base. Okay, first one is the hydrocarbon based paste. So these are the pastes which mainly contains greasy substances such as a white soft paraffin, petrolactants, like that. Example for this is a zinc oxide paste. Okay, and second type of paste is the water miscible paste. So they usually made with a polyethylene glycol basis or a greaseless and a wash off easily. Okay, and third one is oil in water emulsion paste, so which allows for some drug solubility and a better skin compatibility here. Okay, so each type has its own use depending upon the patient condition and the drug being delivered here. Okay, and next one is the composition of the paste. So how these pastes are composed or formulated means, so the formulation of the paste involves three major components. Okay, first one is the base, and second one is the solid phase, and third one is the preservatives and some stabilizers. Okay, so what is about this paste means, the first one is the base, so which acts as a vehicle or a carrier here. Okay, so it may be a oleaginous, aqueous or emulsion based. Okay, and second one is the solid phase, so which involves the active pharmaceutical ingredients and the absorbent materials like kaolin, starch or zinc oxide. So such materials will be used as the solid phases here. Okay, and third one is the preservatives and stabilizers, which ensures the product materials remains stable and free from the microbial contamination. Okay, for that purpose we will use. So let us see the ideal characteristics of the paste here. Okay, so an ideal paste should meet certain critical quality attributes here, like it must be stable both physically and chemically. So it should be a smooth, homogeneous and non-irritating to the skin. Okay, it must retain its shape and consistency even at body temperatures. Okay, a good paste should spread easily on the skin but not melt or run off. Okay, and most importantly it should act as a protective barrier, especially in wounds and inflamed skins. Okay, so all these are all the various ideal characteristics of the paste. And next one is the mechanism of the paste. So how the paste works on the skin. So due to their thick immobile nature, so paste form in a solid barrier over the site of application. Okay, this barrier mainly protects the skin from the friction, moisture and external irritants. So this barrier mainly absorbs the secretions and exudates. So it mainly helps the drug stay in contact with the skin longer time and enhancing the local actions. That's why they are ideal for conditions like eczema, burns, ulcers and infections. Okay, so this is about the mechanism of action of the pastes. So common ingredients and their functions. So let's take a look at the common ingredients used in the paste formulation here. It includes mainly zinc oxide, starch, kaolin, petrolactam or a white soft paraffin, lanolin, salicylic acid or tretinoin. Okay, First start with zinc oxide. It mainly acts as a mild antiseptic and the astringent here. And second one is the starch, which mainly serves as a thickening and the absorbent agent. Kaolin, it helps absorbs discharge from the wounds. Petrolactam or whites of paraffin, it is used as the greasy base here. Okay. Linonin, which mainly enhances the absorption through the skin. Salicylic acid acts as an active ingredient depending on the conditions. Okay, each component is selected carefully based on the disease, skin conditions, and target action. Okay, like that we have to choose the ingredients. And next one is steps in the formulation of the paste. So the preparation of the paste involves the following steps like trituration, lavigation, incorporation, homogenization, and finally packing. Okay, so in case of trituration, so finely powder the solid ingredients to achieve the uniform particle size here. Okay, so for that simply we will take the ingredients of the paste and simply we have to triturate in a mortar. Okay. And next one is the lavigation. So wet the solid powders with a small amount of the base to form a smooth paste and reduce grittiness here. Okay. And next one is incorporation. So gradually add the remaining base while continuously mixing to get the uniform product. Okay. So and then homogenization. It mainly ensures even distribution of all ingredients throughout the final product. And then packing. So pack into a collapsible tubes, jars or a plastic containers under hygienic conditions here. So each step must be done with a care to ensure the consistency, uniformity and the patient safety. Okay. So these are all the various steps involved in the formulation of the pastes. Example of the pharmaceutical paste. Some popular pharmaceutical paste includes zinc oxide paste, which mainly used in the diaper rashes and the minor skin irritations. And the second one is the salicylic acid paste. It is mainly applied in treating corns, calluses and psoriasis. And third one is the tretinoin paste. It is mainly prescribed in acne treatment and the skin resurfacings. Okay, so these products are well tolerated and provide prolonged local action due to their high retention on the skin. Okay, and next classical example is the zinc oxide paste. Here is its simple formula. It includes zinc oxide 25%, starch 25%, whites of paraffin 50%. So both zinc oxide and the starch are lavigated with some paraffin here, and then the remaining base is added gradually. So the result is a thick, smooth protective paste widely used in the diaper rashes and eczema here. Okay, next we will see about the quality control test for the pastes. So before being marketed, pharmaceutical paste undergoes several quality control tests like viscosity measurement, drug content uniformity, spreadability test and stability testing. First one is the viscosity measurement. It mainly ensures the correct thickness and the flow behavior. And second one is the drug content uniformity. It mainly confirms even distribution of the active ingredients. And third one is the spreadability test. It mainly checks how easily the paste can be applied. Okay, it mainly confirms that the paste remains effective and unchanged during the storage. Okay, so these tests are essential to maintain the therapeutic efficiency and product safety. And next one is the advantages and disadvantages of the paste. So let us summarize the benefits and the limitations of the paste here. First, advantages. So it remains at the site of application for a long duration. That is the main advantages of this paste. And second one is it has an excellent protective and the absorbent properties, and it provides a local effect with minimal systemic absorption. Okay, all these are all the advantages. Disadvantages means it can be difficult to spread due to the thickness. So that is the small disadvantages here. And it may stain clothes if greasy, and it is unsuitable for use on hairy or the mobile body parts. So still their advantages make them a top choice in the dermatology. let us see the differences between the paste and the ointments. There are so many differences are there between these two semi-solid dosage forms. First point is their paste mainly contains the large amount of the finely powdered solids such as starch, zinc oxide, calcium, so whatever it may be. So they mainly contains large amount of the solids here. Okay, whereas in case of ointments, what we have now, so they contains the medicaments which are generally dissolved, suspended or emulsified in the base here. Okay, so not in that much large amount as the paste. Okay, so that is the main difference here. So they are very thick and stiff. In case of paste, what they are very thick and stiff in nature. So due to presence of the high solid content, obviously the consistency will become thick and stiff here. So whereas in case of ointments, they are the soft and semi-solid preparations. Okay, pastes are very less greasy in nature. So due to the high solid content, they are that much not greasy. Okay, and coming to the ointments, they are more greasy, and pastes are generally applied with a spatula or a spread on lint. Okay, so these ointments application, it is very sort of simply just applying to the skin. Okay, so they form in a protective coating to the area where it is applied. Okay, so the paste will form obviously the protective layer coating. Okay, in case of ointments, they are used as a protective or emollient for the skin here. And the paste contains a large amount of powder which is porous in nature, so hence perspiration can escape. Okay, so these ointments are used for the protection of the lesions here, and pastes are less macerating than the ointments. The ointments are more macerating in the action. Okay, so all these are the various differences between the paste and the ointments here. Okay, conclusion. In summary, pastes are an important semi-solid dosage forms with a great benefits in the external application here. So their high solid content, excellent retention on the skin, and the protective functions make them ideal in many therapeutic conditions. So formulating an effective paste requires a scientific precision in selecting the base, solid agents and the stabilizers here. So whether you are a pharmacy student, a formulator or a healthcare professional, so understanding paste formulation is essential to your knowledge. So thank you for watching this in-depth guide on the formulation of the paste. If you found this video useful, don't forget to like, share and subscribe to Medi for more pharmaceutical science content. Got questions? Drop them in the comment below. Until next time, keep learning and keep compounding.